What's going on, guys? Tony Maritato here, licensed physical therapist, and I wanted to give you an update on my shoulder following the COVID booster injection. So a week ago, today is Sunday, November 28th, a week ago Monday, I had the booster injection. I shared a video about my response to it, my biceps tendinopathy, pain, symptoms, virtually completely disabled my use of the left shoulder. Today, 100% back to normal. Like, I can do everything that I want to do. It was a gradual improvement. It hit a peak of my disability about 36 hours after the injection and then gradually improved. I can tell you that during the peak of the most painful, uncomfortable, limited mobility, I really wasn't doing much of anything with the shoulder, but I was still fully functional. I had no flu-like symptoms. I had no headache, no back pain, nothing else. It was solely the left biceps tendon. And so while I couldn't do anything with the arm, I couldn't pick anything up, I couldn't carry anything, push or pull, functionally the rest of my body was still fine. I still walked, I still exercised, I still went into the clinic to treat patients. And I can tell you that each day after about that 36-hour period, it was gradual improvement. As of today, I would say that I'm 100% pain-free, no sensitivity, no soreness anywhere throughout the shoulder. It never affected anything beyond the biceps tendon, but I can tell you once again, as a licensed physical therapist, if I came to myself as a patient describing the symptoms that I was experiencing, I would have no doubt that it was a mechanical problem, when in fact it was a chemical problem. It was an immune problem that was affecting my mobility, my function, my use of that arm. So guys, just food for thought. It's always helpful to hear a physical therapist's own personal experience with various symptoms and sensations, because they're not always injuries. In this case, there was no injury to the bicep tendon. It was simply the response to the booster. Now, everything is all set, resolved, ready to get back to my full workouts tomorrow. And I want to appreciate each of you for taking the time to watch these videos and educate yourself so that you can then kind of understand your body, process a little bit better, ask better questions, and find the answers that you're looking for. I'll catch you guys on the next video.